Going to be on a very current, burning topic, and that is the issue of people slumping and dying. Now, one of the things that happen is that our people, have taken it for granted because of the economic situation. Nobody knows his health status, and this is one of the major causes of slump and die. That is why a person wakes up well and healthy and feels fine, and before you know it, he suddenly collapses and dies. It has happened. We have had many celebrities going that way, and it's common, and it's getting worse. A day passed one day in my hospital, and in the morning they brought a dead body. He fell down and died before he could be rushed to hospital. In the evening, before I could even leave the hospital, they brought another person with the same story. So it's common now that this thing is happening everywhere. Many hospitals have them. Many other records have. No, many people, many are not recorded. Now, what are the causes? One of the major causes is that the organs are having problems, and people are not, checking their organs, doing tests to check their health status because of the economic situation. So one of the major causes is lack of medical checkup. If you don't check yourself, you may have the issue of slump and die because the organs may have problem and you don't know. One of the organs that may have problem is the heart. Heart failure is a big problem in our generation now due to change in diet, and so in order to avoid it, make sure you check your heart once or twice in a year. You can go for a checkup, you can do your ECG, you can do your echo, and these things will help you to know the status of your heart. Number two is that you have to be on your drugs if you have been discovered to be hypertensive. So many people say they don't feel anything, there are no sign, no symptom, and they feel that they're okay. They are not okay. Hypertension is very quiet and is silent. That's why they call it silent killer. So if you have been identified as a hypertensive, make sure you are on your drugs on a daily basis, and make sure you check your BP, your blood pressure. Don't skip it for any reason. It can be one of the causes of your people slumping and dying. Another major cause of slump and die is when the issue of lipid, that is your cholesterol. Cholesterol can be a problem, major problem, because if it is high, it is a problem in the sense that it can detach part of the blood, become a problem in the blood, go into the bloodstream, go to the brain and block the arteries, or it can go to the heart and block the arteries, and the heart can fail and the person can slump and die. Then another one is stroke. Stroke does not just come. Stroke is as a result of high uncontrolled blood pressure or high cholesterol level, in that something can detach from the artery and go into the brain and block it. It is something that happens in the brain. So make sure your cholesterol level is controlled. Make sure your blood pressure is controlled. Make sure you know the status of your heart to start on time to take care of them. Now, another major cause of it may be because of stress. People can slump because of stress. Hunger, extreme hunger. People may be very hungry and they have not eaten for days, and they will be walking on the streets, and in the next minute you see them slumping and die. Low sugar. Person can have low sugar. Then issue of low blood pressure can come in. People have low blood pressure when their blood pressure is lower than the normal average, and when it happens, the person can slump and die. So these are the major things, and you have to avoid them. If it's low blood pressure, there are some drugs you take for it, and there are some measures you can take, practical measures, which I will talk in my next video. So make sure that all these factors I called out today are taken care of. If they are taken care of, this issue of slumping and dying will reduce in our population. The more knowledge you have, the healthier you live. Thank you. I still remain Dr. Solution, aka Dr. Vitalis.